everyone, I'm Kanageswary here. So today I'm going to talk about what is diuretics and types of diuretics. Let's go to the next slide. What is diuretics? A diuretic is any substance that promotes diuresis, the increased production of urine. This includes forced diuresis. There are several categories of diuretics. All diuretics increase the excretion of water from bodies, although each class does so in a distinct way. Here are some types and names of diuretics. First, osmotic agents, name mannitol. Next, carbonic anhydride inhibitor, name acetazolamide. Next, thiazide, name hydrochlorothiazide. Next, loop diuretics, name anthocyaninic acid. Finally, potassium sparing, name spironolactone.
Hi, I'm Shamita. Diuretics mainly act on kidney by increasing water and electrolyte excretion. Nephron blood flow shows that bodily fluid passed through nephron by glomerulus will filter into Bowman's capsule to pass proximal tubule, loop of Henle, and distal tubule. Each of these has water permeability and fluid absorption. The absorbed fluid will go into collecting duct, which are then excreted to the bladder as urine. Diuretics inhibit the luminal, sodium-potassium ion, and chloride as co-transporter in thick ascending limb of the loop of Henle. Water and electrolyte excretion may increase, and it inhibits reabsorption of much greater proportion of filtered sodium than any other diuretic agent. Diuretics compete for the chloride binding site on the sodium or chloride co-transporter that is selectively expressed in the distal convoluted tubule, inhibiting its ability to transport ions. Inhibition of the co-transporter lowers intracellular sodium, which then results in a lowering in the intracellular calcium mediated by sodium or chloride expressed on the basilateral membrane.
Hi, I'm Fazeelah. Today I would like to talk about usage, advantages and side effects of diuretic to athletes. Let's move to next slides. Firstly, let's see the usage of diuretics. Diuretics are used to treat several conditions in medicine including high blood pressure, heart failure, kidney disease and some liver disease. Next slide is the advantages of diuretics is to reduce body weight. For example, diuretic use can allow an athlete to transiently reduce body weight, which is an advantageous in wrestling, boxing, judo, and weightlifting as well as in a general sports. Next is side effect of diuretic to athletes, which is osmotic diuretic therapy can cause dehydration due to loss of water in excess of electrolyte loss. So, the common adverse effect or side effect is headache, nausea, and vomiting. Hyperglycemia can occur as a result of glycerin metabolism.
Hola friends, I'm Vennilaa. Now I'm going to talk about why diuretics should be banned in sports and the athletes that have used diuretics as drug doping in sports, which had went through a lot of side effects, even fatal. Diuretics is the third most abused substance used in sports. Top two diuretics acts as masking agents are furosemide and hydrochlorothiazide. One of the athletes that caught doping is Marion Jones, a Belizean American former world champion track and field athlete. She has used steroids and diuretics prior to the 2000 Summer Olympics and has lost 5 medals.
Jones has got them brilliantly. It's 10-7-0. What a run.
I pled guilty to 2 counts of making false statements to federal agents, and I am responsible fully for my actions. I want you to know that I have been dishonest. You have the right to be angry. I have let them down, I have let my country down, and I have let myself down.
Athletes, particularly in bodybuilding, have lost their lives at a very young age, and some had undergone severe side effects because of performance-enhancing drugs and diuretics. A graphic example occurred late in the career of boxer Mohamed. He took a diuretic despite not having to make weight. The drug made him listless and weak in the ring. Legendary speed were greatly diminished. He lost to a less skilled opponent. In 1988, pro bodybuilder Albert Bachelor collapsed and convulsed while posing at a pro contest. He is subsequently resuscitated by paramedics and found to be suffering from diuretic-induced dehydration. One of the fatal cases was occurred in 1992. Pro bodybuilder Mohamed dies. An autopsy shows that he was severely dehydrated and undergo cardiovascular failure at the age of 33. He had used a combination of content diuretics prior to the show. Another known case was at a British amateur bodybuilding competition. A competitor, Andy Roddy, collapsed and dies on stage from an overdose of diuretics. So friends, let us think wisely. Are diuretics worth the cheap?